I'm pleased to introduce the closing keynote session, Advancing Health Equity Through a Child Policy Lens, with Lisa Wolf. Lisa is the Director of Policy Research at UNICEF Canada. Her mission is to advance the rights of Canadian children in Canada to develop to their fullest potential, consistent with international human rights standards. Collaborating with government, institutions, civil society, and researchers, and the private sector, Lisa works across issues and sectors to advocate for and with children and youth. She's an advocate and an advisor to many initiatives, including Making the Shift, Networks of Centers of Excellence Implementation Management Committee, that's addressing youth homelessness. And Lisa received the Queen Elizabeth II Diamond Jubilee Medal from the Governor General of Canada in 2012. Over to you, Lisa.
Well, thanks for the kind introduction. I really appreciate it, Lisa. And I'm just going to share slides and hope you can see them as I set them up. There we go. Is that visible? Slides are visible?
Sorry, I was muted. Yes, it's okay. Great. Thanks.
Okay, great. So hello, everyone. I'm joining you today from the traditional territory of the Wendat, the Haudenosaunee, and the Anishinaabe peoples. It's in the jurisdiction of the Williams Treaty, which for settlers is just north of Toronto in York Region. And I'd like to recognize as well my position of privilege in the many dimensions that privilege is experienced. And I do apologize in advance if I have chosen any insensitive or harmful words or concepts that reflect my biases, and I'll be looking certainly for how I can correct and learn from that and make amends as we go. The question that I'm, bringing to all of us today is, how can we put child health and achieve child health equity through all policies that affect children's lives and help ensure better and more equitable outcomes for each and every child? And of course, there are many different approaches to support this goal, and I've really appreciated learning from the speakers that have gone before me and the conversations that have been held today. The focus that I'm offering is a practice that is emerging in Canada and in different jurisdictions around the world called Child Rights Impact Assessment, or CRIA. And we thought it would be important to bring this to you because it is taking hold it's certainly taken hold in the federal government, it's taking hold in different provincial and territorial governments. So I'm going to outline what this is, how it works, how it can be used to help achieve child health equity, where it's currently underway in Canada, and some ideas for how you might be able to use it to support the work that you're doing. So the public policies that we're seeing, or different public policy approaches that we're seeing in Canada, and really gaining momentum in other countries, including high-income countries like Canada, have sort of two different directions that they're coming with. One is a health in all policies approach embedded in public policy making. And this is a health-specific approach, trying to spread considerations of how we can better support people's health in all policies, but it is not necessarily child-specific. And then we have a children in all policies direction taking root in government policy making. And this is child-specific, but not necessarily health-specific. And that is the focus of health in all policies is on health. It could address children. It doesn't always. The approach to children in all policies always focuses on children and does address a whole range of considerations that can affect child health or in turn be affected by children's health status and health care. Child rights impact assessment is focused on the latter. It's using the Convention on the Rights of the Child as a framework to consider how we can achieve health equity through public policies that affect children. And what we're doing in this case is using a framework that's established in international law. It's a framework of entitlements that children have that the Canadian governments have obligations to deliver on. So it's a range of conditions that are not just nice to have and nice to do if governments have money or have thought about doing them. These are actual entitlements and claims that we can make on the state to ensure good child health, equitable child health, and all of the conditions that support child health. And the child rights impact assessment process is really a tool to help policy developers use this framework. They don't go to child rights school. It's easily overlooked, the fact that we have this obligation among state parties to the convention that these rights have to be fulfilled for each and every child and equitably. So that's what child rights impact assessment helps to do. So using this framework is going beyond just considerations of what we think about typically when we think about child health. And it invites decision makers to think about the other rights that connect to health, like does every child in a country have recognized status? Do they have citizenship? Are they able to access health and other health providing or health supporting services, including childcare and income benefits? Or are they excluded based on arbitrary decisions about who is entitled to that within our country? Children have rights to protection from all forms of violence and exploitation, to participate in decisions that affect them, to practice their culture, including specific provisions for Indigenous children. They have the entitlement to every one of the 54 legal articles in the Convention on the Rights of the Child, and they have these rights without discrimination. And these rights are all interdependent and interconnected. So undermining one of these rights has negative ripple effects on all the others. Depriving children of adequate nutrition, as we know, will affect their health, their education, and their other rights. And the reverse is true. When children are healthy, when they're accessing optimal health care, there are positive impacts across almost every other aspect of their rights and well-being, including their development, their education, their ability to participate in society, their protection, and so on. So policies are also interdependent. And it's really difficult to name a government department or policy area that doesn't have the potential to shape children's healthcare and health status. Every policy sector should consider the different ways that the decisions they're making could affect children and their interdependent rights. So we're using this framework to provide a holistic rather than an issue-specific or sectoral lens on child policy. And hopefully, if this is done well, help to ensure better child health policies, better policies that support child health, and better health equity. And as a process, again, to support all of this, child rights impact assessment has been growing in momentum in Canada. Before I get to where and how and who, I'm going to provide some definitions from different jurisdictions of what this process actually is and what it's meant to achieve. In the simplest of terms, CRIA is a process to systematically consider the likely impacts of policy proposals. They might be laws, bills, they might be budget proposals, they might be program changes or new programs, they might be policies. To look at how, when a decision is being shaped right at the outset, that it might affect diverse children and their rights before that decision is baked and served up to children. And so the aim is to have decision makers remember to see children in the decisions that they're crafting, to make children visible, ideally to hear them, and ideally to make them a higher priority in the decisions that they're making in order to achieve better and more equitable decisions and outcomes for children. Sometimes CRIA is brought into the policymaking process because states, governments are recalling their duties under the Convention on the Rights of the Child, and sometimes it's because they see it as a process of due diligence. They're not wanting to make decisions that are inequitable or that have unintended negative impacts. So there's different motivations. Sometimes it's more of a due regard to children's rights, and sometimes it's more of a due diligence, quality assurance type of motivation. And I'm bringing a definition from a Department of Health in particular, which I thought might be interesting to those of you here. It's seen as a tool that can help decision makers by providing a structured process to remember to think about children and their rights. I mean, ideally, this is done naturally, and because policymakers are concerned about children and care about children and have the knowledge to make good decisions in consultation with stakeholders and children themselves. But as we know, this doesn't always happen. So it's a bit of a corrective mechanism, given also that governments are always needing to balance different interests and sometimes forget actually they have the obligation to make children's interests their priority. So CRIA is taking its place increasingly in a family of policy impact assessments that are used by governments, and different jurisdictions tend to adopt different policy lenses. They do this because they want to prioritize certain interest areas or certain populations and not overlook them. And you might be familiar with, in Canada, the different choices that have been made at different levels of government. Gender-based assessment is present in many jurisdictions. We have privacy impact assessment, environmental impact assessment. Some jurisdictions in Canada use equity assessment or even health impact assessment. There's even small business impact assessment in federal Treasury Board regulations. And none of these is designed specifically to consider impacts on children. Children can still be overlooked in these different lenses that governments have chosen to reflect their priorities. And so we say, why shouldn't children be one of these priorities? And in fact, when children aren't given a specific lens on policy, they are typically overlooked or frankly subordinated. They don't vote, so their claims on government are easy to overlook, and they don't have many mechanisms otherwise to have a voice on decisions that affect them. Children are also often assumed to experience impacts of public policy decisions that are the same as for adults. If it's good for adults, it's got to be good for children. Yet we know that children are at a distinct stage of human development and a distinct legal status where they don't have full control over what is done to them, to their bodies, where they are moved to. That legal status creates sometimes vulnerabilities as well. So they are owed a specific consideration by decision makers when they're making decisions that affect children. And as UNICEF likes to say, there is no child neutral policy. Most decisions affect children, if not directly, then certainly indirectly. So how does child rights impact assessment work? Well, fundamentally, it is a process that is wired into the policymaking process. So it looks something like this, like the schema on this slide. Typically, the policy development process starts with policy makers identifying a problem that they want to address with a policy solution, and they define the objectives of that, the proposal, to address the problem. And then they'll outline what they want to do, and if they've got different options to address that problem, they'll set those out. And then they look at potential impacts, using the different policy lenses that have been chosen, make recommendations, implement the policy, and it cycles back to monitoring, evaluating, and maybe reforming that decision. So how do we make room for children in that process? Well, first of all, starting with that problem definition, CRIA asks decision makers to ask themselves, is this proposal addressing a problem that's actually been identified as a problem by children, for children, or their advocates? Who is it a problem for? Who's identified this as a problem? And would the solution that you're seeking to put forward be meaningful? For whom? So even starting with that very first part of the policymaking process, we want to start thinking about that in children's terms. How will how is this problem a children's problem? How is it violating children's rights? Putting it in rights terms, who is this going to help? And what are the objectives in terms of securing children's rights? Who benefits? Who might bear different negative impacts? So that's where we get into the real qualitative assessment. Just as the tools that were presented before reminded us, these are not checklists. The quality of assessment depends on the quality of the people doing the assessment. So how do we make sure that's good? What CRIA asks policy developers to do is ideally to bring in other stakeholders to help them understand the problem, their proposals, the potential impacts of those proposals, including children and youth, and ask questions like, which children are going to benefit, who is going to benefit more, who might experience negative, unintended impacts or be left out, who might experience the benefits if we have mitigating measures on a policy that might be good for some people and less good for children. There's a whole range of questions that should be asked to come out with the best possible recommendations for the best policy proposals, the best options available, and the best ways to make good impacts for children better and more equitable, and curb the potential negative impacts, or at least mitigate them and do that equitably. So I'm just going to use the example of parental leave policy as a quick, simple example to illustrate this process. So as you might know, in Canada, I'm speaking about Canada outside of Quebec, parental leave is attached to employment insurance, and that's how it's delivered. And about 1 in 3 infants is left out of paid parental leave entitlements, left out of an entitlement to paid protected time with a caregiver at birth. And this rises to 40% for Indigenous children, infants, and 60% for infants in low-income families. And in most jurisdictions, infants born with complex health conditions and disabilities are not entitled to any special additional support, even though the costs to the family are often greater. And when a policy developer might be looking at, say, a reform to parental leave, they should be looking at dimensions like that. Who's left in, who's left out? What are the international norms and standards around this? Canada hasn't ratified the ILO Maternity Convention, which sets inclusivity in terms of eligibility and also higher pay as a universal ideal, not limited to certain children by virtue of certain parents being privileged with parental leave entitlements. So I like to use this example of parental leave because parental leave is a child health policy. It's a child health equity policy. It's associated with so many positive health outcomes for children and parents. It supports breastfeeding, good mental health for both infants and parents, immunization. There's more likely to be access to health care if a parent can take leave and bring the child into healthcare services. And I could go on. The policy paradox is that parental leave entitlements, and this has been adjudicated even in courts, parental leave entitlements have been squarely regarded as entitlements for parents, and even more narrowly for working parents, rather than being seen as a policy that children are entitled to have paid and protected time with a parent. And so policy decisions can be very different depending on the lens through which they're made. I mean, adoptive parents have been excluded from equitable leave time and pay compared to other parents because courts and parliamentary committees have seen those parents as having a different class or status than other parents, rather than looking at the needs and rights of children to paid and protected time with parents, regardless of their parents' status. And I'm just sharing another example of what I call upside down policymaking that fails to consider children as an entitled or affected population, which can have serious health impacts. And in this case, there was a court case called Inglis versus British Columbia, when failure by a government to consider children's rights and entitlements caused a decision to basically end up in a court challenge. And the case involved the mother-baby program at the Alouette Correction Center for Women. It had been allowing infants to remain with their mothers at least for a period of postnatal care upon birth, and the program was canceled. And this was brought to court challenge, and the court found that that policy decision to cancel the program violated the rights of children to be cared for by their mothers, and that the correction system was obligated to accommodate and respect their rights. And in this case, the court did use the Convention on the Rights of the Child and different rights within the convention to make its judgment. So overlooking children can end up in court if it's not done in a proactive way, and cause a lot of harms along the way. So how does child rights impact assessment advance equity? Let's deepen this question. First of all, a core consideration is whether a policy will be intergenerationally fair and equitable. So CRIA, just at the outset, by asking how might children be affected, is attempting to support the equitable treatment of children by virtue of their age relative to other populations. And certainly, as I mentioned before, age comes with a distinct legal status as well as a stage of development that requires specific consideration. And this is a positive distinction. So, we can help avoid overlooking children, but we can also help avoid negative distinctions like statutory discrimination of children on the basis of age, which can easily be introduced in policies, including health policies, when we make unjustified assumptions about children's capacity or autonomy, including the imposition of arbitrary age limits when it comes to decision-making or entitlements or access. And second, in another consideration when it comes to supporting the equitable treatment of children as a group relative to other groups, we use CRIA to ask how might, and I'm coming back to the question I raised earlier, how might different groups of children differently experience a policy or a government decision? And a basic axiom of public policy is that the benefits of policy decisions tend to flow to already more advantaged groups, and the negative impacts to those already facing discrimination and equity without specific consideration and distinct measures to achieve equity. So for children, this requires really concerted consideration of their different, the different dimensions by which they intersectingly experience inequities that might shape how they're experiencing different impacts of a policy decision. And that might be on the basis of their race or disability or location or the age of the child, young children, older children, their evolving capacities, their citizenship state, and so on, and taking an intersectional lens to achieve substantive equity or avoid disproportionate harms is what CRIA supports. It asks policymakers to consider the distributional impacts on children, also based on their different roles in a policy. So, for instance, a Justice Department might wish to introduce a policy to make it less traumatic for a child victim of crime, abuse, violence, exploitation, to provide their court testimony. And so measures like screens or recusing them from cross-questioning by defense might be put in place to protect children, which are specific measures that might not be in place for adults. What CRIA does is ask, what about other children involved in this policy? In this case, what about the impacts of a decision like that or measures like that on children who are defendants in court proceedings, who are still children, still have rights? Might their defense be impaired by such measures? And I'm not going to attempt to answer that question today. I'm using it as an example of how different groups of children can be implicated in policy proposals, but easily overlooked without a structured, systematic way of asking that question that is supported by CRIA. So let's look at a couple of examples of how CRIA has actually, in practice, been applied to health policy. Internationally, there are more than 20 countries that mandate the use of CRIA. Many of them are in high-income countries, which is an interesting area for discussion in of itself. It is being applied to many types of decisions in the different countries where it's used at different levels of government. And this slide just gives you a taste of a few. Some of these are obviously more centered on health or health-related policies, and others might seem a bit more distal to that, but can have impacts on health policy, including the voting age. But this just gives you a broad sense that many different jurisdictions, any level of government, can use CRIA and apply to different policies. And actually, in practice, it's often the policies that aren't considered child policies or child-specific policies where it can have the most benefit by recalling to decision makers the need to think about children specifically and the differential impacts that their decisions can have on children. During COVID, CRIA was used in different countries, and it did play an important role in these countries to better balance the interests of different groups and work to prevent excessive equity gaps in policies responding to the COVID-19 pandemic. Virtually everywhere, children disproportionately bore the negative impacts of COVID restrictions, including isolation, increasing their depression and anxiety, mental health issues. Those facing discrimination and colonialism were more likely to bear the negative impacts of both the virus and the policy responses to it. But countries like Scotland and Wales that had been already using CRIA ran their COVID policy responses through CRIA and were able to proactively consider COVID policy decisions, and including public health restrictions on children and their rights. And we saw them, I would say, compared to Canada, generally speaking, better able to adapt those measures to be sensitive to the impacts on children and mitigate the negative impacts on children. And what we find is that when evidence is lacking or insufficient, as it, policy developers will always tell you they don't have all of the information, evidence that they would like in making decisions. But there's always children's rights. That framework of the convention is always there. And certainly the hallmark of the pandemic, at least in the early stages, was a lack of information. So we had children's rights available to guide decisions in the countries that were using that as a framework to consider their decisions, whether it was school closures or children's access to outdoor facilities or income supports. And countries like Scotland and Wales, again, continued to apply CRIA, and they kept applying it as the pandemic evolved and new information came to light. They didn't just one and done CRIA. And we saw other child-sensitive approaches being brought into CRIA assessment, like in Wales, a coronavirus and me survey reached 23,000 children. I'm not quite sure how they managed that during a pandemic, but 23,000 children between ages 12 and 18 in Wales ensured that their views were heard, and they did inform policy decisions that were being made as part of the CRIA process. And what the survey revealed was top two restrictions that concerned young people the most were not being able to spend time with friends, not being able to visit family members. So this influenced decisions like widening the geographical area in which children were allowed to interact with other people so they could reach their family members and so on. The Welsh government also applied CRIA to a health policy. I'm just giving you this as an example of a specific health, directly sectoral health policy. And in this case, they were considering new measures to restrict the marketing of unhealthy food and drink, including price discounts or price promotions for unhealthy food and drink. And essentially the CRIA assessment found that price discounts and some of the other measures they were contemplating would generally have a positive impact on disability, because overweight and obesity in children and young people was linked to a range of disabling conditions. It did consider some other health inequities. It recognized that the highest levels of health burden due to unhealthy food and drink were present in communities with more material deprivation, more poverty. It considered the potential negative impacts in these communities of prohibiting price promotions and discounts because they do make food and drink less expensive, but also found that because they were asking good questions, they found that price discounts on unhealthy food and drink also encouraged people to buy about 18% more food and drink than planned, which is relevant to material conditions. So they were asking good questions. I can't guarantee they came up with the best solutions, but the point of CRIA is bringing more equity considerations, more child-specific considerations into the deliberation, and coming back to the point that the quality of assessment is always going to be generally only as good as the people involved in it. In this case, the government created as they called it, an implementation board to assess the policy proposals and arrive at a policy decision. It included the Children's Commissioner of Wales. It included children's ambassadors, and they helped to shape broad child and youth consultations of quite diverse children across the country on that policy. So moving to child rights impact assessment in Canada. Again, a motivation for bringing this information to you. Last July, the Department of Justice released a CRIA process and tool, and an online training course that frankly anybody could take, not just public officials. And the Justice Department has always had a protocol by which legislative proposals, bills, would be reviewed for their impacts on children's rights, but they didn't have a systematic way to do that. And so they have now released a child rights impact assessment tool, and it is also unfolding in different provinces and territories in different ways. And so as CRIA takes root across different levels of government in Canada, and hopefully across different federal departments, not limited to the Justice Department as it currently is, we'll start to see better and more transparent and accountable decision-making that ideally involves children and youth, but at minimum creates decisions that are better and more equitable for them. So in other jurisdictions, we've learned that child rights impact assessment does tend to have positive impacts on decisions, and that children are better represented in those decisions. This is just an example of a statement from a county in the U.S. It's in the state. Well, it's Memphis area. Shelby County. It's one of the counties with the highest levels of poverty in the state. And child rights impact assessment has been used there for some time. And we see this kind of testimony in different jurisdictions where it's used. We don't have a lot of academic and evidentiary reviews of CRIA impacts because often the assessments are cabinet protected and considered privilege. That is not the case in some countries like Wales. You can go online and see the different child impact statements that they publish, which is more transparent and more easily challenged by stakeholders. So that would be the ideal approach. What I want to say, though, is where we see CRIA being used, and New Brunswick was the first jurisdiction in Canada to begin to use CRIA about a decade ago, is that there are three main types of implementation challenges that can really curtail its potential to achieve better and more equitable decisions for children. One is the inconsistent use of CRIA. If it's not applied consistently to as many different types of decisions as possible, it's just simply not going to show itself as being effective. If the analysis is not robust, if it's not inclusive of different points of view and diverse points of view, especially by affected people that are experiencing the deepest inequities, then it's not going to yield the kind of policy proposals that could do the most to achieve equity. And there's always the potential to sacrifice the results of a good assessment to political expediency and the desires of political leaders to push through certain policies. So how do we counteract that? Well, there have been supreme audits of gender-based assessment in Canada, like the Auditor General has undertaken studies of how gender-based assessment is doing. We could envision the same for CRIA. We can remind parliamentarians that they have a duty to legislate that is consistent with children's rights, and ask them to ask for CRIA assessments on different bills or government decisions, especially when they're hearing government witnesses. And if you are in a jurisdiction where CRIA is being used, you can ask for these assessments, or at least the conclusions of the assessments. You might be able to contribute as an expert with your living experience, or even as a parent advocate or a child and young person to CRIA consultations. So hopefully this session has given you some information about what's happening in Canada, and brought you into the developments that are occurring. And we see a lot of potential as UNICEF Canada for achieving better and more equitable decisions for children through CRIA. It's not the only tool, the only way to do so, and we need to do our utmost to make sure it is. So thanks very much. I'm going to stop sharing my slides and really welcome discussion.
Oh, thank you, Lisa, so much for this great presentation. This is my opportunity to poke the audience for some questions and or comments for Lisa. Lisa, what's the next step for organizations like ours collectively, those child health advocates, child health equity advocates? What's the next step in what should we do next to embed the child rights assessment in the work of policymakers across a number of different levels?
Well, thanks, Paula. One step you could take is have a look, and the slides I expect would be shared with this group, but there is a link to the new Justice CRIA tool, and you can easily Google it online as well. It's available in French and English. But if you're interested, have a look at the CRIA tool, even consider taking the course yourself and see what you think about it. If you see potential in this tool, and you are engaged in advocacy directed at the federal government, a key thing you can do, as we're starting to do, even, there's a new bill that's come out on online harms, Bill C-63, asking, where is the child rights impact assessment? Has it been done? Even if that assessment is protected as privilege, what conclusions were reached? Were you concerned with any potential negative impacts, and on which children? And how were those negative impacts taken into account in the bill? And we're asking parliamentarians to ask for that, ask those same questions, as they do often when government officials come before them. They ask about the results of gender-based assessments. So that, those are a couple of different things that you might do. And if you are from one of the provinces where CRIA is taking root now, certainly New Brunswick, Yukon, and there are developments in PEI. Sometimes the smaller provinces are more progressive and open to new ideas. And if you are in those areas, you can ask for and ask your child and youth advocate's office, because they are typically partners in getting CRIA established in those jurisdictions. But how is this rolling out, and how can you get involved when there's a policy that you care about, and to use this tool or ask that this tool be done in a good way?
Thanks so much. We've all got a lot of work ahead of us, and hopefully we'll see it in all of the jurisdictions, applied in all of the jurisdictions soon. Ryan asks, what kind of feedback have you received from MPs, MLAs, MNAs while developing or even advocating for the implementation of the tool?
Well, a lot of support. I mean, it's been good. Very positive. They understand that gender-based assessment, for instance, only takes us a certain way. It doesn't automatically require that we consider impacts on children. It does ask about age, but it doesn't necessarily then, if it's determined that children, by virtue of their age, might have distinct impacts that have to be looked at, or it doesn't necessarily take you into the full framework of the rights under the convention. Right. It might be overlooked that children have privacy rights or rights to participate, because the GBA tools don't explicitly support that kind of assessment. We also, with Children's Healthcare Canada, developed a light CRIA tool, if you will. We call it the child policy lens, to distinguish it from a government obligated, frankly,
No,
process
right.
about children's rights. It's called the Child Policy Lens, and we developed that with Children's Healthcare Canada, but with advice from parliamentarians, including Senator Moody, who sponsored it, and asked for a lot of feedback from staff who support senators and MPs. Would they use it? How can we make this usable for them as a way to perform their due diligence? Again, now that government should be undertaking CRIA, they should be asking similar questions as they look at bills. So there was a lot of support for that.
Oh, fabulous. We've got a few positive comments we'll share with you after, and I see that there is another comment. Let me just find it here. How can we enable and support governments to incorporate these impact assessments through the decision-making journey? So how do we embed it in their routine work? Obviously, there's some provinces ahead of it than others, but is there particular recommendations you have?
Yeah, I mean, it's not an easy sell, because we're persuading governments to take on more work and diligence when they always feel they have little time as it is, and not enough resources to develop policies. But it's very interesting, the different motivations that different jurisdictions in Canada have had, and the different entry points to get CRIA going. So in New Brunswick, 10 years ago, I think it was safe to say that the Executive Council Office was very interested to have strong policy proposals come up from the departments, because there had recently been a policy decision that had some negative blowback, unintended negative impacts on children. And so quality assurance was a motivation, and it got the conversation going. In all the provinces where we've worked as UNICEF Canada on this, we have done so in partnership with the Child and Youth Advocates Office, which is on the ground in the province. They've been a partner in PEI, Yukon, New Brunswick. But all of the political entry points in those jurisdictions have been different. In PEI, it's been, the entry point has been an all-party motion that passed unanimously in the legislature for CRIA. In New Brunswick, it was a policy directive from Executive Council to departments. And in Yukon, it's been a ground-up approach, getting sectoral policy officials in different departments through the Advocates Office with support from UNICEF Canada, just socialized to the idea of how this can help them make their decisions stronger. And that's led to a brand new, as of a month ago, inclusion in as a policy directive in Executive Council, much like the New Brunswick model. So there's no one single entry point, different ways to get this going, and you have to really be persistent and have good partners, and it can take several years.
Yes, patience is definitely a virtue when it comes to policy, anything really. Thank you, Lisa, for a wonderful presentation. I'll pass along all the great comments, not just from Canada, but there's someone here from New Zealand who's been searching implementation and use of various policy lenses like you're discussing, and it wasn't something she'd considered before now in her work with childhood disability. So she was pleased to have that highlighted for her. So thank you so much. I have a few to summarize sort of the day. The first session, we learned of the CPS, the Canadian Pediatric Society's anti-racism initiative. We learned that we have a lot of work to do individually from the perspective of acknowledging our own bias and power and privilege, and how our actions in the past may have affected or even harmed some folks inadvertently or otherwise, and just work and learn in order to do and be better in the future. We learned of a number of resources, one of which was that CPS anti-racism policy and the work that accompanies it. My goodness, my tongue is tied. and the review tool that went along with this for reviewing their internal organizational policies that could be adapted to review your own. We learned of Jordan's principle, of the child rights impact assessment, of the child policy framework, and of a health equity framework that includes patient experience, health human resources, health systems policy and practices, including improved reporting systems and data, health system policy audit using perhaps one of the tools that has been provided or this framework, a trauma-informed and people-centered, child-centered lens, increasing our focus on equity-based data. Frequently, we're not collecting data that allows us to know which communities and which children from which communities we are not achieving the optimal outcomes from our care, and we need to have data in order to be able to understand who we're better serving and who we're potentially leaving behind. The removal of red tape and barriers, that is a constant in any kind of policy work, and frankly, embedded in many of our organizations. Recognizing, again, the internationally trained workforce as a solution to the HHR crisis, particularly for the specialized needs of children and youth. We need to think of linguistic equity as well as gender affirming care and equity related to the LGBTQ2+ community, and increasing equity in representation in health leadership and on the front lines, and establishing this health equity framework partnership charter. So there's guidance to how to convene your partnership and move it along in a direction towards a shared goal of child health equity. I want to say a huge thanks to our sponsors, the IWK Health Center. You'll hear Krista in her closing messages. I don't know why I'm thinking legalities now. And our strategic partner, One Child, Every Child, for their support to make this series possible. I'll now hand things back to Dr. Krista Jangard with her closing arguments and close our session today. Thank you so much.
Thank you, Paula. Sometimes it does feel in this world that we do have arguments. And, you know, as I listen to you make that long list of what we've heard today from our discussions, from our speakers, I'd really like to thank the speakers for sharing their time and their expertise with us. I'd also like to thank everybody who participated in those discussions that brought forth all those points. The comments and questions are really important as we continue this important work together. And I think of the beginning of today when we were talking about equity and equity populations, and then really drilling down and thinking about that extra layer that we need to think about with the rights of a child and how that adds even more complexity, particularly as children start as babies, become children, become youth, and that changes over the time frame of what their impact and what their say needs to be in what we do. So thanks to everyone who's participated today, but also in the other two sessions. IWK was very pleased to be part of the support for this really important topic. And although we're wrapping up the Child Equity, Health Equity Learning Series, I see this not as the end of our discussions, perhaps not as the beginning because we're all in different parts of our journey, but someplace in the midpoint of our journey together that will be easier if we do it together and walk together and learn from each other. If you missed any of the other previous sessions and this session, check online in the next upcoming weeks. They have been recorded, as you know, for today. And there will be copies of the reporting and an event summary report within a month or so as we look at how we did with this. One of the things we really need to know is what worked for you in these sessions that we're having, what experiences were good, what could we do differently, what do you want to know about next time? And we also would like to gauge a little bit of interest in whether or not joining a Canada Child Equity Health Equity Network would be something that would be of interest to any of you. And I think they're going to pop in a link to that so we can get some feedback and some interest for you. And it should be showing up in your chat. The same as an evaluation of the day and an evaluation of what you would like to hear more about, where we go next with this incredibly, incredibly important topic as we think about equitable access for health for children and their families because they coexist together. So thank you for everything and all the discussions today. We look forward to hearing your feedback and to being able to meet again in our next episodes as we move forward. So thank you to Children's Healthcare Canada for hosting this and putting it together. And everyone have a wonderful weekend wherever you are in this wonderful land we live in.